I'm Kyle McCormick. For this week on InFocus, I spoke with Jacob Hacker, professor of political science. He's written a number of books, including The Great Risk Shift and Off Center. He is also co-director of Berkeley Law's Center for Health, Economic, and Family Security. Professor Hacker regularly testifies before Congress on economic security and is an informal advisor to Barack Obama. I spoke with Professor Hacker about health care and economic inequality. Professor Hacker, thanks so much for joining us today.
Thanks for having me.
Appreciate your time. We want to talk about health care because that's a big issue in this election. Can you briefly explain what is the state of health care in our country today?
Well, I think it's fair to say our healthcare system is in crisis. Over the last 25 years or so, we've seen a major erosion of employment-based health benefits. That's the main way most people get coverage, and that erosion has really accelerated in the last 5 to 8 years. And at the same time, of course, more and more people lack coverage that provides them with adequate protection. So depending on the estimates, we're talking about maybe 1/3 of those who have insurance, non-elderly Americans who have insurance, may not have adequate protection. So we're talking about a very serious problem.
The two presidential candidates have very different ideas about health care. McCain focuses more on decreasing the price or slowing down healthcare inflation. He also has a tax credit to help people pay for private healthcare plans. I mean, how do you interpret that?
You know, first of all, I should say I'm not an unbiased observer in this discussion. I was one of the people who helped shape the Obama health plan, but I'll try to be as unbiased as possible in saying that the McCain plan is a total disaster. It's a total disaster, and it's not a total disaster because his focus is on controlling cost. I actually don't think that's a fair description. His focus is basically on shifting risk onto individuals. He wants to move away from our reliance on employment-based health insurance that people get from their employer to individual insurance that you buy on your own. The estimates suggest that if you did what McCain wants to do, which is to change the tax treatment of health insurance so that people are paying taxes on their health care benefits from their employer as if it's just another form of compensation like wages, and give them a tax credit instead. If you did that, we'd probably have about 21 million Americans who would get dropped from employment-based health insurance.
So since you say you're unbiased and you've helped craft the Obama plan, can you explain some of the key elements of the Obama plan
Sure.
and try to sell it to somebody who might be unconvinced at this point?
Well, it's got 3 key elements. It says if you have employment-based health insurance and you're happy with it, nothing changes. If your employer doesn't provide coverage, then you would be allowed to buy coverage through a new national system. That national system wouldn't be a government-run health plan. It would basically be a system through which you could either sign up for public insurance, something like the Medicare program, or buy some private plans that are regulated by the government to make sure that they take all comers, that they don't design their benefits or market in a way that means that they're only taking healthy people, and that they can't exclude pre-existing conditions and so on. So you get a choice of public or private insurance. And then the question is, well, how do you make that work? And you have to have some kind of way of ensuring that employers don't all say, oh, hey, have a good time, go get your coverage from this national system. So employers, large employers that don't provide coverage would have to make a contribution if they didn't provide coverage.
All right, Professor Hacker, thanks so much for joining us today.
My pleasure. Thanks for having me.
All right. Well, that's it for this week. Special thanks to Professor Jacob Hacker for joining us. And until next time, stay focused.